Mental health is quickly becoming a popular topic in the public arena. Professional athletes, actors, and world leaders are entering the conversation by sharing their personal struggles and the benefits they've received from professional counseling. While you've likely heard many stories about the ways counseling has helped people struggling with grief, depression, addiction, anger issues, trauma, marital problems, and a host of other challenges, you may not know what counseling is or how professional counselors are trained. This brief video describes counselors and the counseling profession. Counseling is one of 4 mental health professions. In the state of Ohio, clinical counselors, clinical social workers, clinical psychologists, and psychiatrists have the same scope of practice, meaning all 4 can diagnose and treat mental and emotional disorders. The only exception in this scope is that psychiatrists prescribe medications. The American Counseling Association defines counseling as a professional relationship that empowers diverse individuals, families, and groups to accomplish mental health, wellness, education, and career goals. Counseling is a profession. To practice as a counselor under supervision, an individual must obtain a master's degree and complete 700 hours of supervised clinical work, pass a licensure exam, and apply to a state board for license approval. To practice independently, a counselor must complete an additional 3,000 hours of clinical work, pass a second licensure exam, and apply to a state board for independent licensure approval. Counseling is a professional relationship with a client. Working together, the counselor and the client identify and accomplish the client's goals, whether they are mental health, wellness, education, and/or career goals. Some clients work with counselors to accomplish short-term goals in just a few weeks or months. Others may work with a counselor for years to achieve longer-term goals. Similar to other professions, such as law or medicine, counselors are governed by a number of factors. All counselors are required to act in accordance with a professional code of ethics. The Code of Ethics is a form of self-regulation that helps counseling professionals hold one another accountable for upholding the standards of the field. Counselor education programs are accredited to ensure all counselors are trained to the same standards. The State Licensure Board protects the public by overseeing counselor licensure, and finally, counselors are governed by the laws of the state. While counseling, social work, psychology, and psychiatry are clearly defined in the Ohio Revised Code, coaching is not. Counselor training is extensive and in-depth. Counselors are trained to understand, utilize, and conduct research. Our work is evidence-based. Counseling is also the only mental health profession specifically trained in career counseling. Counselors receive extensive training in human development and human relationships, including interpersonal, family, and group dynamics. Counselors are trained to assess for mental and emotional issues. They are also trained in social, cultural, professional, and ethical issues. Men go to counseling for many reasons. You may have heard others talk about going to counseling for depression, anxiety, marital problems, or career issues. While these symptoms often bring men into counseling, it's the benefits of counseling that make it a useful tool many men use. Men who engage in counseling report experiencing growth, peace of mind, healing, perspective, and development of vital mental and emotional life skills. Thank you for your time and attention. We hope this video has given you a deeper understanding of the counseling profession. Please remember to complete the post-test survey before you go. Thank you.